Magnesium is one of the most recommended supplements for seniors. Your doctor may have mentioned it. Your friends probably take it. And everywhere you look, someone is telling you it is good for your muscles, your sleep, and your heart. But for some people over 70, it is not helping at all. It is actually making things significantly worse. Today, we are going through 4 signs that magnesium is dangerous for your body and 4 signs that your body genuinely needs it right now. Number 4. You have kidney disease. Most people who take magnesium supplements assume their body will just use what it needs and get rid of the rest. And for people with healthy kidneys, that is exactly what happens. But if your kidneys are not working properly, that assumption is dangerous. If you have been told you have kidney disease, reduced kidney function, or that your kidneys are not working as well as they should, magnesium can build up in your blood to levels your body cannot handle. You might not feel anything at first, but as the levels keep rising, you may start feeling unusually nauseated, more tired than normal, or notice your muscles feeling weak in a way that is hard to explain. Some people describe it as a heaviness in the body that was not there before. These are early signs that magnesium is accumulating to toxic levels. Your kidneys act as the filter that removes excess magnesium from your bloodstream. When you take a magnesium supplement, your body absorbs what it needs and your kidneys clear the rest through your urine. When the kidneys are damaged or weakened, that clearing process slows down or stops working entirely. Magnesium keeps coming in through the supplement, but it has nowhere to go. It builds up in the blood. At high enough levels, it can cause your blood pressure to drop dangerously, your breathing to become shallow, your heart rhythm to become irregular, and in severe cases, it can cause the heart to stop beating. After 70, kidney function naturally declines, even in people who have never been diagnosed with kidney disease. Your kidneys filter blood less efficiently than they did when you were younger. This means that even mild, undiagnosed kidney decline can make magnesium harder to clear from your system than you realize. Many older adults have reduced kidney function without any obvious symptoms, which makes this sign particularly easy to miss. If you have any history of kidney disease, kidney stones, reduced kidney function, or if you are on dialysis, talk to your doctor before taking any magnesium supplement. A simple blood test can check how well your kidneys are filtering and whether magnesium supplementation is safe for you. This is one situation where checking first is genuinely important and could prevent a serious problem that would otherwise be completely avoidable. The next sign is one that catches a lot of seniors off guard because magnesium is often recommended for the very condition that makes it dangerous for them. Number 3. You have low blood pressure. Magnesium is frequently recommended for people with high blood pressure because it relaxes the walls of your blood vessels and allows blood to flow more easily. For people with high blood pressure, that effect is beneficial. But if your blood pressure is already on the low side, that same relaxing effect can push it into a range that becomes seriously dangerous. If you have ever stood up from a chair or gotten out of bed and felt the room spinning, felt your vision go dark for a moment, or had to grab onto something to keep yourself steady, you already know what low blood pressure feels like in your body. These moments are not just uncomfortable. For a person over 70, they are a major fall risk. A fall at this age can mean a broken hip, a hospital stay, and a recovery that takes months. Magnesium relaxes blood vessels throughout your entire body. When you take a supplement and your blood pressure is already low, those vessels relax further and your blood pressure drops even more. Your heart has to work harder to push blood up to your brain and the rest of your body against that drop. The result is dizziness, lightheadedness, and that sudden, unsteady feeling that puts you at risk of falling. After 70, blood pressure regulation becomes less efficient. Your body takes longer to adjust when you stand up or change position, which is why dizziness on standing is already more common with age. When magnesium lowers your blood pressure on top of that slower adjustment, the combined effect can be dramatic and happen very quickly. If your blood pressure tends to run low, if you have been told it is on the lower end of normal, or if you regularly experience dizziness or lightheadedness when you stand up, bring this up with your doctor before starting magnesium. There may still be ways to get the benefits safely at a lower dose or a different form, but it needs to be a supervised decision. It is also worth knowing that if you are on blood pressure medication and your pressure has recently come down more than expected, magnesium could be a contributing factor worth mentioning at your next visit. What comes next is the sign that most people would never connect to magnesium on their own because it involves something happening deep inside the heart. Number 2. You have a slow or irregular heartbeat. Your heart beats because of a precise sequence of electrical signals that travel through the heart muscle in a specific pattern. Magnesium plays a role in regulating those electrical signals. For most people, that role is beneficial and helps keep the heart rhythm steady. But for people whose heart already beats too slowly or whose electrical signals are already disrupted, magnesium can make a manageable condition dangerous. If you have ever been told you have a slow heart rate, a condition called bradycardia, or that you have any kind of irregular heart rhythm, or if you wear a pacemaker, magnesium supplementation can interfere with the electrical activity your heart depends on. You might notice that you feel more fatigued than usual, that you feel short of breath during activities that did not use to wind you, or that you feel a fluttering or heaviness in your chest. These can be signs that your heart rhythm has shifted in a direction it should not have. Magnesium slows the electrical signals that control your heart rate. In someone with a normal or fast heart rate, that slowing is often exactly what the heart needs. In someone whose heart already beats too slowly or whose rhythm is already fragile, that additional slowing can push the heart into a rhythm that does not pump blood effectively. In serious cases, it can trigger a cardiac event. After 70, heart rhythm irregularities become more common and are often managed carefully with monitoring or medication. The margin for disruption is smaller. What might be a minor shift in a younger person's heart rate can be a significant and dangerous change in someone over 70 whose heart rhythm is already being carefully managed. If you have ever been diagnosed with any heart rhythm condition, if your doctor has mentioned your heart rate is slow, or if you have a pacemaker, do not add magnesium supplements without a direct conversation with your doctor first. This is one of the clearest cases where the supplement that is safe for most people is genuinely unsafe for some. Now we move to the final danger sign, and it is the one that affects the most seniors on this list because it involves medications that millions of people over 70 take every single day. Number 1, you are on certain medications. Magnesium does not just affect your body on its own. It interacts with several common medications in ways that can either make those medications stop working or make them work unpredictably. And because these are medications that seniors rely on for serious conditions, those interactions matter enormously. If you are taking antibiotics, magnesium binds to them in the stomach and blocks your body from absorbing them properly. You could take a full course of antibiotics for an infection and have the medication fail not because it was the wrong antibiotic, but because the magnesium you took that morning prevented it from getting into your bloodstream. If you are on antibiotics for a urinary tract infection, a chest infection, or any bacterial infection, and also taking magnesium, the infection may not clear the way it should. If you are taking heart medications, particularly digoxin, which is used for heart failure and irregular heart rhythm, magnesium can change how that medication is absorbed and used by the body. On some days, the medication level in your blood may be too low to be effective. On other days, it may be too high, which increases the risk of side effects and heart rhythm problems. Heart medications like digoxin require very stable levels in the blood to work safely. Magnesium disrupts that stability. If you are on muscle relaxants, combining them with magnesium amplifies the muscle relaxing effect significantly. Your blood pressure can drop too low, and your heart rate can slow more than intended. After 70, you are more likely to be on multiple medications at the same time. Each one you add increases the number of potential interactions. Magnesium is often seen as harmless because it is a natural mineral and available without a prescription. But natural does not mean it cannot interfere with prescription medications that are keeping your heart stable or fighting an infection. Before starting magnesium, bring a complete list of every medication you take to your doctor or pharmacist and ask specifically about interactions. A pharmacist is especially well placed to catch these interactions, and it is a conversation worth having before you start. Now we move to the other side of this list. 4 signs your body is genuinely running low on magnesium and needs it now. Number 4, your muscles keep cramping or twitching. If you are regularly waking up in the middle of the night with a sudden painful cramp in your calf, or if your leg seizes up when you stretch in the morning, or if you notice your eyelid twitching for no reason throughout the day, these are some of the most common and overlooked signs of low magnesium in people over 70. Magnesium acts as a natural relaxant for your muscles. Every time a muscle contracts, it needs calcium to tighten and magnesium to release. When magnesium levels are low, the release part of that cycle does not happen properly. Your muscles contract but struggle to let go fully. The result is cramps, twitches, spasms, and that tight, locked-up feeling that can wake you from a dead sleep with sharp pain in your leg. Some people describe the pain as so sudden and intense, it takes their breath away. Others deal with a milder but constant tightness in their legs and feet that never fully goes away. A lot of seniors are told their cramps are just part of getting older or that they need to drink more water. And while hydration matters, low magnesium is one of the most common and most correctable causes of muscle cramping in older adults. The two feel identical from the outside, which is why magnesium deficiency gets missed so often. After 70, your body absorbs magnesium from food less efficiently than it did when you were younger. Your stomach produces less acid, which is needed to break magnesium down from food. Your intestines absorb fewer nutrients overall, so even if you eat foods that contain magnesium, less of it is actually making it into your bloodstream compared to what your body used to get from the same meal. If nighttime leg cramps or muscle twitching are a regular part of your life, magnesium glycinate taken in the evening is worth discussing with your doctor. Many people see a noticeable reduction in cramping within 1 to 2 weeks of consistent supplementation. The next sign is one that connects magnesium to something your channel has covered before, and the link is stronger than most people realize. Number 3. You cannot sleep and feel anxious. If you lie awake at night with your mind quietly restless, feeling a low hum of anxiety that has no particular source, or if you wake up at 2 or 3 inches the morning and cannot get back to sleep no matter how tired you are, low magnesium may be a significant part of what is driving that. Magnesium plays a direct role in regulating cortisol, the stress hormone that is supposed to be lowest at night so your body can sleep deeply. When magnesium levels are low, your body loses some of its ability to keep cortisol quiet at night. Cortisol stays elevated when it should be winding down. Your nervous system stays in a low-level alert state. Sleep becomes shallow, fragmented, or impossible to get back once it is broken. You might fall asleep without much trouble, only to find yourself wide awake an hour or two later with no obvious reason for it. That pattern, falling asleep, then waking, and lying there unable to drift back off, is one of the more telling signs that cortisol is staying active when it should not be. The anxiety connection works the same way. Magnesium helps regulate the part of your nervous system responsible for the calm, rest, and digest response. When levels drop, that calming system weakens and your body defaults more easily into a state of low-level stress and worry. You might not even be anxious about anything specific. You just feel unsettled, on edge, or unable to fully relax in a way that is hard to explain to someone else. After 70, cortisol regulation is already less stable than it was when you were younger. Your body's ability to produce melatonin has also declined, which means your sleep is already more fragile. Low magnesium on top of those age-related changes can be the difference between sleeping poorly and barely sleeping at all. If broken sleep and low-level anxiety are consistent parts of your nights and your mornings, magnesium glycinate taken about an hour before bed is one of the most well-supported natural approaches to improving both. It works best when taken consistently over several weeks, rather than expecting results overnight. Number 2. You are over 70. This one is different from the others because it is not about a specific symptom. It is about the reality of what happens to magnesium absorption as you age, and why being over 70 puts you in a category where deficiency is far more likely than most people realize, even if you eat well and feel generally healthy. By the time you reach your 70s, your body absorbs magnesium from food at a significantly lower rate than it did in your 40s or 50s. Your stomach produces less acid than it used to, and stomach acid is what breaks magnesium down from the food you eat, so your intestines can absorb it. Less acid means less absorption, regardless of how much magnesium is in your diet. At the same time, your kidneys begin excreting slightly more magnesium through urine as part of the natural aging process, so your body is taking in less and losing more simultaneously. The result is that many people over 70 are walking around with magnesium levels that are technically low without experiencing any single dramatic symptom that points clearly to the deficiency. Instead, what you might notice is a collection of things that each seem unrelated. You feel more tired than you used to. Your sleep is not as deep. Your muscles feel tighter. You feel more anxious than you did years ago. Your energy takes longer to come in the morning. None of these individually screams magnesium deficiency, but together, in a person over 70, they paint a very clear picture. Many older adults eating a reasonable diet are still deficient simply because their body can no longer extract and retain magnesium the way it once did. If you are over 70 and have not specifically discussed magnesium levels with your doctor, it is worth bringing up. A simple blood test can give you a starting point, and even if the results look normal, symptoms and age together are worth a conversation about whether supplementation makes sense for you. Number 1. You have diabetes. This is the sign that most diabetic seniors have never been told about, and it matters because the connection between diabetes and magnesium deficiency runs in both directions. Meaning low magnesium makes diabetes harder to control, and diabetes makes magnesium deficiency worse. Here is what is happening inside your body. When your blood sugar is high, your kidneys work hard to remove the excess glucose from your bloodstream by flushing it out through your urine. Magnesium gets swept out along with that glucose. Every time your blood sugar runs high, you are losing magnesium. If your blood sugar has been difficult to control over months or years, the magnesium losses add up significantly. What makes this a genuine cycle is that magnesium is essential for insulin to work properly. Insulin is the hormone that moves sugar from your bloodstream into your cells. Magnesium is one of the key minerals that allows your cells to respond to insulin's signal. When magnesium is low, your cells become less sensitive to insulin. Your blood sugar becomes harder to control, which causes more glucose in the urine, which flushes out more magnesium. The cycle feeds itself and quietly worsens over time. After 70, this cycle is more pronounced because the age-related decline in magnesium absorption we talked about in the previous sign combines directly with the diabetes-related magnesium loss. You are losing more and absorbing less at the same time. If you have type 2 diabetes and you have never discussed magnesium with your doctor, bring it up at your next visit. Research suggests that maintaining healthy magnesium levels can improve insulin sensitivity and support better blood sugar control over time. It is not a replacement for your diabetes medication, but for many people, it is a meaningful piece of support that they have been missing for years without knowing it. Given how common both diabetes and magnesium deficiency are in people over 70 and how directly one worsens the other, it is one of the more important conversations you can have about your long-term health. Now we want to hear from you. Do you take magnesium, or have you been wondering whether it is right for you? Tell us in the comments below. We read every single one. And if you found this helpful, please give this video a like and subscribe so you never miss what we cover next. Thanks for watching.